Namaskar, this is Alok Singh. Today we will try to understand effect of opium on the heart and on the kidney. We all know opium as a crude drug is most commonly used for the hallucination and intoxication purposes. Use of opium as hallucination and intoxication is considered as abuse or misuse of opium that cause drug addiction or that develop drug addiction. But opium is also an excellent medicine that is used to cure various disorders of our body. In previous class, we studied effect of opium on the gastrointestinal tract, and we understand that opium causes constipation whether it is used for the intoxication purpose or for the medicinal purposes. Today we will concentrate effect of opium on the heart and on the kidney. First, effect of opium on our cardiovascular system or on the heart. In normal dose, it does not affect heart functioning, means it does not affect heart rate and blood pressure. But if opium is administered in the large dose or in the overdose, in that condition it develops hypotension and the bradycardia. Hypotension means decrease in blood pressure and bradycardia means decrease in heart rate or slow heart rate. This hypotension and bradycardia mainly due to three effects of the opium, that is the respiratory depression, stimulation of the histamine secretion and depression of the vasocenter in the brain. Especially these two effects, respiratory depression and vasomotor center depression, decreases the respiration rate that cause accumulation of carbon dioxide inside the blood vessel. This carbon dioxide accumulation inside the blood vessel cause blood vessel dilation, and this blood vessel dilation led to decrease in blood pressure, that is the hypotension, and also cause the bradycardia, means decrease in heart rate. This opium affect release of histamine. Histamine directly affect the blood vessel that produces the blood vessel dilation, that also led to decrease in blood pressure and decrease in heart rate. Due to these three effects, that is the respiratory depression, that is the histamine release, and that is the vasomotor center depression, cause hypotension and bradycardia. This histamine also cause constriction of the respiratory muscles and bronchoconstriction. Thus, if patient is asthmatic, in that condition morphine, codeine or opium should be avoided and it should not be administered to these patients. This opium also cause blood dilation of the cerebral blood vessels, means dilation of the blood vessels in the brain, and it increases the cerebrospinal fluid pressure, CSF pressure. Thus, morphine is not recommended during the brain injury or during the brain surgery. So these are the effects of opium on the heart. Now we will try to understand effect of morphine or opium on the urinary system. We all know in the therapeutic dose, this morphine or opium develop rigidity in the skeletal muscles as well as smooth muscles. Urinary bladder that store urine, its wall is also made up of smooth muscles. This morphine in the therapeutic dose increases rigidity of urinary bladder muscles. Urinary bladder has also one sphincter or one valve. Morphine increases the rigidity of the urinary sphincter or urinary bladder valve. And last one is it increases the tone of the urinary bladder muscles. When we are using or administering this morphine or opium in the higher dose or in the overdose, in that condition it depresses the urinary system. This depression of urinary system is mainly due to development of the hypotension. We studied that morphine causes hypotension. Due to this hypotension, there will be decrease in the renal blood flow, and decrease in renal blood flow will cause or will lead to decrease in the urine formation, and this all led to urinary retention. Means there will be decrease in the urine formation, and due to rigidity effect of this opium on the smooth muscles, it will cause urinary retention. Means ultimate effect of the opium on the urinary system is the urinary retention. There will be problem to excrete urine even in case of the urinary urgency. Means in the urgency condition there will be problem to excrete urine. So these are the effect of opium on the heart and on the kidney. Means in conclusion we can say opium cause hypotension, cause bradycardia, and it causes urinary retention, and there will be problem in the excretion of urine even there is a urinary urgency. Thank you very much. I hope you understand all these topics. If you have any questions, any doubt, please put your doubt in the comment box. Thanks a lot.